and welcome to another episode of Two Old Psychologists Talking About Stuff. So, yeah, this is our new venture where we're having a season of guests. We've been doing this as pretty much a two-hander since the inception of the idea, but we, slightly bored with each other's company and thought we'd involve a few other people just to give you some alternative perspectives on ACT. So, before we do that, I just want to catch up with Ray. Hello, Ray.
Hey, Rich. Good to see you.
How you doing, my man?
Not so bad, thank you. Not so bad at all. Enjoying a little bit of sunshine, which is good.
And so what's been going on? As is customary, I want to ask you what you've been noticing since we last spoke.
Well, a couple of days ago, I was involved in a conference, but it was an online conference. So I was sitting in this exact same chair that I always am. But we ended up with a panel that was quite international and an audience that was quite international. And I think the thing I just noticed was what a nice thing that was. It's fantastic to be in person. It's fantastic to travel to places to do things. But there was something kind of special about the fact that we could meet as a group of people from different countries and know that the people who were kind of listening to our presentation were also spread throughout the world, out as far as Finland, New Zealand, all sorts of places. So, yeah, I felt good about that.
What did you notice liking about that, sort of in contrast to actually going somewhere? Because I know that you travel quite a bit for this kind of stuff.
I think one of the things I liked was it cut down other distractions. Pretty much everybody involved in it was in their own space, and we were fortunate that the technology was working well for us. So we were just able to really focus in on, it was about, typically for me, it was about grief. And so each of us was able to just focus in on the things that we wanted to say. And there wasn't really the distraction of being, a bit jet lagged or distracted by being in some amazing and interestingly new place.
It is amazing, isn't it? In just a few short years, like I think even probably 10 years ago, the idea of an international conference where you didn't leave your house would have been like science fiction.
I was thinking that me of not that long ago would have been amazed at the capacity to do this. And yet it worked. And I managed to meet some, even using that word, I managed to meet some really interesting people. In one sense, I haven't met them at all. I've just seen pixels flickering on the screen and heard noises coming through my earpiece. And yet people I'd not met before, people I had admired their work for ages, very, very highly respected grief scholar called Mary Frances O'Connor was on the panel. So I was basically fanboying about this great academic. And we're still not met, not literally. And yet we were able to work together and it seemed to go smoothly. And what about yourself, Rich? What have you been noticing?
Well, mine is another kind of march of technology thing. I've noticed for the first time, this is probably quite predictable, but I've noticed it just creeping in the last few weeks. A slightly nagging doubt about whether the stuff I'm seeing is real. And this is, I guess, largely due to the rapid growth of AI technology and the ability to kind of, fake pretty much anything. But also, I suppose, maybe the post-truth era where
Okay.
it's a little bit hard to know the veracity of the claims that people are making in public. It was typified for me by just a couple of weeks back. I don't know if you heard the story about Pete Hegseth, the I don't know what you call him, the Secretary for War or something.
Secretary for War in the United States, yeah.
United States, yeah. And he delivered a prayer at a meeting, and the prayer was almost line for line a speech from Pulp Fiction.
Mm.
There was some, I think if you really look at what in the video, he kind of just about gets away with it. But it was sort of, what was being reported was that he'd been quoting from the Bible, this verse from Ezekiel, but it wasn't the verse from the Bible, it was a bunch of lines from Pulp Fiction. And I thought, that just can't have happened, right? I can't imagine that a member of the administration, of the top level of government in one of the most powerful countries in the world, would have been conducting a prayer at a meeting which was indeed the script from Pulp Fiction. I thought that just can't have happened. That must be AI, right? That must have been an AI-generated thing that I've just seen there. But apparently it did happen. But sort of, that's kind of a slight aside really, but the psychological thing for me is this creeping doubt that I'm noticing about whether things I'm seeing and hearing in the media are actually real. And that
Right.
strikes me as being quite an unsettling and dangerous thing.
Okay, so in terms of like as people say these days, content within the media, it's not so much kind of a doubt about the reality of your day-to-day life, which of course is something that afflicts some people, but it's not so much that, it's is this video clip that I'm seeing real? Yeah. One of the only things that gives me hope here, and it's probably misplaced, is the history of how easily we have been fooled by simulations of things and how quickly we become more sophisticated about it. So there was a story about the first time that there was a moving picture film of a train coming into a station, shown in, I think, a cinema in Paris. And the audience apparently screamed and ran out of the room because this train was about to hit them, even though it's just like clearly scratchy bit of film. And the first time that somebody did a stop frame animation of a dinosaur, people seriously thought they were looking at a real dinosaur. And we see that now, and it's just shonky. Similarly, the first few times I saw the AI generated images and cartoons, I was completely taken in. Now some of them you can kind of see. But I just wonder whether it's just going to constantly accelerate. We'll always be catching up.
I mean, it does bring us onto a whole other conversation, which is maybe this whole thing's a simulation.
That may be a bigger one than we can crack this just today.
Yeah, you're probably right. Too unsettling to think about that. It's an interesting thing, isn't it? I just think it's inevitably going to get worse. I take your note of hopefulness. Maybe we just adapt to it. But I think the influence of AI will be such that it's harder to tell what's real and what isn't real. Yeah, it concerns me going forward. Anyway, we need to introduce our guest.
We do.
So it gives me great pleasure to welcome Dr. Dawn Johnson. Welcome back, indeed. You are we've just been talking about the fact that we've been doing this podcast as a two-hander, but you're appearing as a guest for the third time, which is unprecedented. So welcome. For people that might not have heard those earlier episodes, do you want to just say a little bit about yourself and who you are?
Yeah, absolutely. Well, first of all, thank you for having me back. It's an absolute privilege to be back for the third time. For anybody that doesn't know me, my name is Dawn Johnson. I work as a clinical psychologist. I'm now working in private practice. I do therapy and supervision, do some training, run events, do away days, those kind of things, and predominantly using ACT and more widely using contextual behavioural science as my main psychological approach. I am also the current president of the UK and ROI chapter board for the Association of Contextual Behavioural Science. So I've been on the board for 4 years and been in the president role now for just over a year.
So Dawn, ACT is clearly a huge part of your working life and I'm sure personal life. One of the questions we're always interested in is, how did you get involved in it in the first place?
Meeting today is a really interesting way to answer this question. So I found some things at the weekend that were a little bit of a revelation to me, which was interesting. So I found in my diary that I did some ACT training when I was doing my clinical doctorate course, which would have been 2008. So that was my first ACT training, was 2.5 days. And then what I also found this weekend as I was unpacking boxes from moving house, obviously a very long time ago, I found some journaling notes that I'd made, which referenced using my ACT skills and thanking my mind and having those kind of tools and techniques, I suppose, at my disposal in my own journaling process, which was really interesting. So that was 2013 I found those from. Previous to that, I would have said I first started really embracing ACT as a psychological model in 2014. I did my first training at Birmingham ACT Week and really started to put it into practice straight away with my client work and really quite authentically for myself as well, in terms of learning as much as I could. I bought every new book going. I got really involved in how I could live and breathe this model because it really started to fit with my view of the world. But it also really fitted with the work I was doing at the time. Was in a learning disability service, and I've taken that into all the other roles I've had since. So it just feels like a very humane model that I think is applicable to all settings, really. And that's one of the reasons I've found it so helpful. So a
Wow.
long exposure to ACT at this point.
And it clearly grabbed you fairly early as a good fit with the work you were trying to do and a good fit with how you looked at the world.
Yeah, absolutely. I think that's one of the things that grabs me about the model is it fits with a sense of, I love the fact that we start from a place of not being broken, which personally, I think probably all of us have had moments in our lives where we feel we are, like we're beaten, where it's overcome us. There's too much, it's too much. And ACT kind of literally starts from a stance of that's not where you're at, that actually we're really stuck and we can do something about stuckness. And I think right from the off for me, that was something that was very appealing and something I was very curious about. I didn't really understand it at the time because, of course, our feelings take over, right? And we get hooked by, no, I am broken. No, I am like, there's something wrong. But the consistency of the model, I think, is very helpful. Applying that personally and in how I then would view my clients. I don't think I've ever sat across from a client and thought there's something wrong with them. A really interesting reflection for me to have. Like it doesn't matter what somebody brings into the therapy space with me, I never think that there's no hope. I never think that they're broken. I never think that there's something wrong with them. And if I can think that about people and their lived experiences, what if I do that in my direction too? Like it's a helpful way to make that perspective take is a helpful and kind way to also continue to embody the model, right?
Right.
I'm reminded there of the Australian psychologist, Dr. Eric Morris, who's a acquaintance of all of ours. I think we've probably all hugged him at a conference at some point. He once said of ACT, "This shit sells itself," which is a typically Eric thing to say. But there is something about the kind of personal resonance. Like if you can sort of tune into that, it's a hard thing to explain. But I think whenever I've done ACT training, one of the things I most commonly get as a bit of feedback is this was so helpful to me personally, and I wasn't expecting that. You know, these people come along for a professional training day. They're doing some CPD, and they're expecting to learn a few skills and to help them in their work. And people are often they get a bit hit in the feels by some of the message of ACT or some of the exercises we do along the way, and it feels like it has that kind of resonance. And if you can get that right, like people just sort of seem to take to it.
Absolutely. And I think once you've experienced it as an experiential kind of somatic, embodied, it's not just a cognitive, like I've got to learn this thing and then go and do it to somebody else in a room. I think there's something very different in how you then deliver that therapy or that supervision or that interaction with a friend or a family member. You know, when we tune into our values and we're making active choices, there's something very different and enlivening about that I think is very appealing. So absolutely, if you hit somebody in the feels in a training session, it's highly likely they're going to take that out into their lives as well as hopefully then using that professionally, right?
So we got you on tonight because we wanted to tap your knowledge around the application of ACT to physical health. So how did you get into that?
So that's more of a personal journey than a professional one. In terms of services I've worked in, of course, I've worked with people with physical health conditions, but I haven't worked specifically in a physical health service as such. My application for ACT and physical health issues or chronic health conditions in my situation has been more of a personal journey. And here I was using ACT for various other diagnoses, if we want to use that title, and then experiencing my own health conditions has been a natural thing for me to apply ACT to that as well. So that's much more of a personal experience than professional setting experience. Although now work with several people with chronic health conditions and use the model for that. Do you want to know a bit about my health conditions? Would that give us a flavour of what I've been doing?
Whatever you're willing to share, Dom. Yeah, that would be lovely.
Okay, yeah. It's been a hard journey, actually. It's been a really complex journey to get to this point. I feel like I'm still, I don't know, on the train, so to speak. I'm not at the end of that journey by any stretch, which actually is quite lovely in a sense of we never get there, do we? We're never at the end. It's not a goal that we're trying to reach. It's like learning and applying this time after time after time. So that's where I'm at now. The complexity, I think, of my health has been that it's quite a hard thing to diagnose. So I, about 4 years ago, got a diagnosis of something called hypermobility Ehlers-Danlos Syndrome, which at the time sounds like, oh, okay, so you're hypermobile, and that means your joints move to an extended range in comparison to most other people. Sounds relatively simple, sounds relatively easy to identify, to diagnose. I think what's really difficult about it is that most people don't know or understand the complexities that come with that, and the fact that it affects your connective tissue. And connective tissue is throughout your body, is literally everywhere. It affects every single system in your body. So the symptoms can be really widespread, and that's really hard for people to piece together in the medical system that we do have in the UK. So most of the time, people are seen for individual complaints or difficulties, and it's very hard to get somebody to see you from a broader perspective, from a broader kind of holistic perspective. So a lot of my GP visits, or indeed hospital visits at times, have been treated as isolated incidents. And in some ways, that's great. It's very hopeful. You know, you have a problem, you have a pain, you have an injury, you have some treatment for that, you get better. So, you know, akin to a broken leg, you might have that put in plaster, and then you have some rehab, do some physio, and then you start walking again when the plaster cast comes off or the support comes off. And that's just not the way it goes for people with a chronic health condition similar to mine. So that's been a difficult journey to unpick. Yeah, I suppose from an ACT perspective, has been interesting to reflect on, like, the narratives I've hold of myself and how I understood myself in the world. And so it feels like we get bigger and bigger and bigger. There's the layers to the complexity of that seem to grow the more I explore it. I think it's quite common for people to have a diagnosis later in life with these kinds of conditions. And I also think it's quite common to experience a lot of medical gaslighting. So thinking about interactions I've had with various medical professionals where I've been told all sorts of things to leave their office. I've been told there's labels for people like me in a very unkind, unhelpful way. I've been told that they wouldn't put those labels on their system because they don't want them on their medical records, not my medical records. They don't want it on their system. I've been told to get out of people's offices. I've been told to have antidepressants. I've been told to go for counselling. So I think that there's been a huge amount of barriers to trying to get to a point where I could understand what was going on for me and for my body, and not really feeling very supported in that. So yeah, it's been a long and winding journey to get to this point so far.
Clearly. I'm trying to make sense of these initially apparently kind of like separate experiences that were being treated as separate or not treated. So at the point that somebody said, actually, we think it might be this, what was your experience at that moment?
I remember sitting in a clinic room with a professional who suddenly started to say, yes, this matters, and feeling kind of empowered, pleased, heard, seen, respected, curious, like, I don't know what you mean. But all of a sudden, I was 40 and somebody said, all of the symptoms you've just described to me are really important. And nobody had ever said that to me before. So nobody had ever said all of the symptoms, because they would only ever see one at a time. And nobody had ever said that they were important. So I think I started to feel like, oh, that's good. I'm being taken seriously. I feel, respected. I feel validated for that. And that was very quickly then followed up with quite a complex way of getting a diagnosis, working with a GP who literally said, I don't know what you're talking about. I've never heard of Ehlers-Danlos Syndrome. And I said, well, there's various types of EDS. So, if I may have it, we'd have to work out which one of those types it may be. And to be told, well, I've never heard of any of them. I don't know what you're talking about. So at that point, again, felt respected. She referred me to rheumatology. Rheumatology declined that referral immediately, said that they wouldn't see me at all. They didn't need to see me because there's no treatment pathway. So if I have any form of EDS, they wouldn't do anything about it. They would predict at that point it was hypermobility and there's no treatment pathway for that. And there was nothing that they could offer in terms of support or ongoing intervention. So they told my GP to diagnose me. So it was a kind of bizarre feeling, very insecure, very uncertain. My diagnosis then came from that GP who said she didn't know anything about it. After proving I could bend my joints to an extended range, with a bit of a chat about some family history that's a little bit unclear, and to be told you have a diagnosis of something in a way that's very, I'm not sure, kind of curling her lip a little bit, a bit kind of like, oh, don't know, maybe, yeah, I think so. And then to be told, well, that's it then. So I said, oh, I'm really sorry. So what are you going to put on my medical records? Like, what are you saying I've got? And then to be questioned about, so is this a diagnosis? And she went, yeah. So the kind of level of uncertainty that then came with that was something I became quite aware of and felt suddenly very responsible, very concerned, like, is this correct or not? And if it is correct, that gives me something to learn about. And if it isn't correct, like, what else is going on? She, as part of that process, really should have excluded other potential health issues. And I was told that she wouldn't take any blood tests for those things. So I ended up paying privately to have those blood tests taken in order that I could rule out other conditions that may or may not kind of need different treatment. So it didn't feel like it came with clarity. It didn't feel containing at all emotionally. It felt very underplayed. In the learning I've done in the last 4 years about my specific condition, like, the hypermobility is just the tip of the iceberg. It's one thing that perhaps you would notice about somebody, or that you might notice, I may injure myself because of the lack of connective tissue holding my joints together. And that's the tip of the iceberg, really. So, yeah, when I finally got a diagnosis, I thought I'd feel relieved. I thought I'd feel pleased. I thought I'd feel like there was somewhere to go and I could take this forward somehow. It would somehow be helpful and productive. And the lack of clarity that came with that, I think the lack of emotional containment that came with that, it left me feeling really destabilised, actually. It didn't feel like a helpful step in the process at all. Obviously, it was a helpful step because I've been able to learn, and it didn't feel like that at the time. It felt like a life sentence, if I'm honest.
I know that you're quite humble, and you probably won't mention this, so I'm going to mention it. So you've just written a book chapter for a book. It's a collected work, isn't it, of psychologists writing about various different health conditions that they've lived with, and they've spoken about their application of psychology and helping them deal with that. So obviously we want to talk to you about that, and in particular how you've used ACT, because your chapter was about using ACT to help you manage. But just before, I think it's worth sort of double clicking on this. So you've had this condition your entire life, and it was diagnosed, you were just 40. Are you attributing that to the fact that health services are quite siloed? So if you've got some kind of barn door musculoskeletal thing, like, it might get noticed, but if you've got some condition that affects your musculoskeletal system, your respiratory system, your heart function, your digestion, your fertility, etc., 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 it's almost harder to spot because of the way health services are divided up. Is that what you're sort of suggesting here?
I think that's one of the difficulties with our health system, is that, things are treated individually. There's an expected treatment pathway, and at the end of that, you recover, you're better. So absolutely, I think one of the difficulties is that, for example, I was referred to endocrinology in my early to mid 30s, was taken incredibly seriously given the blood results that I'd had back from the GP. I was given an MRI very quickly. They were looking for a benign brain tumour on my pituitary gland. That's essentially what they were thinking it was. I was seen several times in hospital, had lots of consultations with a big crowd of junior doctors also present, because I think they found my numbers quite fascinating. And then I had a repeat blood test and my results came back within normal range, so they discharged me. So I think that's the kind of experience that I've had for my entire life, where something is like off the charts, going wrong, there are symptoms and quite severe symptoms, and then those symptoms stop and it's like, oh, you're better now then, you're fine. And it's very difficult without understanding the complexity of something like the chronic health issue I've got. It's very difficult to say, well, I'm still not fine, because people just hand you a piece of paper with your blood results on saying it's all within normal range. And that's really hard, because as a non-medical professional, how do I speak back to that? So I'm there as a lay person saying, I'm still not well. I don't feel well. I'm not functioning. And yet my bloods are saying everything's fine. So how do we kind of reconcile that? So a lot of the time things are seen in silo.
Feels like there's a kind of related topic here, which I'd be interested in you both talking about, because Ray, I know you've got some expertise in this area too. So one of the issues that this raises for me is that, I guess, if we're looking upon this with some generosity, perhaps some of this siloing of services is just a practical thing, right? That it makes sense to have some expertise in gastrointestinal medicine over here and some expertise in cardiac medicine over here. And there's an extended thing though, which is that one of the big separations in health services, and this is certainly true in the UK, I imagine it's true in lots of other countries as well, is a clear distinction between mental health services and physical health services. And obviously that, it has some practical utility, that, but I wonder if it does result in these things as being completely separate. And I'd really be interested in both of your views around that discrimination. Like, are physical health and mental health completely separate things?
I think the thing I notice when you say that, Rich, is the distinction between whether we're talking about the provision of care and service versus conceptually how we understand human suffering. And there's some dimensions of, even with complex multi-system physical health difficulties, such as Dawn's been talking about, that still a lot of the level of explanation of how that is happening is probably kind of reasonably, mostly kind of attributable within the physical domain. It will have consequences in people's psychological and mental well-being, but actually, a lot of what needs doing isn't necessarily, I would argue, I've been involved in service provision, isn't necessarily there a joining up of the physical health provision and the sort of prevention that's needed for very complex mental health problems. What's actually needed is a better joining up between the physical bits. And then also, what I would argue, and I think it speaks more directly to your point, is when we're dealing with the psychological consequences and the complexities of personally managing the impact of this and bits of behavior change that sometimes end up having to go alongside it. That stuff needs to be joined up. That's where hiving this stuff off to a predominantly mental health service, who are very expert in dealing with certain kinds of problems, actually creates more problems. And we've seen tendencies within this to see sort of all support for longer term physical health problems being handled within the same systems that handle more purely mental health problems. Absolute parity of importance of both, but there is sometimes a difficulty in the difference of where problems are coming from, what the message is for the person with those problems, in terms of the fact that inevitably conditions is complex, create a lot of stress and a lot of suffering. What we don't really want is then to be kind of labeling that as being, well, what you've got there is a mental health problem. That's potentially one of the dangers. Well, that's my opinion, but I'm talking from the service provision end rather than the lived experience end. So I'd be fascinated to hear what Dawn has to say about that.
No, I agree with most of, all of what you've said there, Ray. I think one of the things I do struggle with working from a psychological perspective for myself, but also with other people with chronic health issues, is where does that become, I have a psychological problem that we're now very clearly putting in the camp of psychology, where actually, and in the book chapter, I speak about this in my concluding comments. So one of the diagnostic criteria that may present for people with my condition is anxiety. And I really struggle with that as an idea, because I don't think people are inherently more panicked. I think they are not supported. I think from a lived experience perspective, it's really very difficult to live a life where you feel you can be reliable, where you feel you can show up. I'm invited to do things personally and professionally, and I cannot predict now how my health will be in 6 weeks' time. So it feels very natural to me, not in a psychological label of anxiety, but just that, like, if I'm the kind of person who cares about letting people down, how am I not going to feel that sense of, oh my gosh, what happens if I wake up that morning and dislocate a rib like I've done before? What happens if I wake up that morning and I am unbelievably fatigued, which happens very regularly? Do I have to cancel that training event? Do I have to cancel that time with my friend? Like, that's not, to me, from a lived experience perspective and from my client's perspective, when I think about what people talk to me about in sessions, that's not anxiety. That's having values and worrying that you can't live by them.
Mm.
So this feels like it's quite naturally drifting into ACT territory. I just want to double click on something you said earlier, though, because you said, which is a very ACT-y thing to say, which is that you don't want to construe your clients as having something wrong with them. But I just to clarify, I guess you're not you're not talking about the physical health problem there. So the physical health problem can be very real. Like, let's say, like I know that you experience a lot of chronic pain, for example. There's a difference, isn't there, though, between pain in the sense of the physical signals that your body is generating
Mhm.
and the emotional pain that arises as a consequence of that. I just want to check that that's what you're saying. Drawing
Absolutely.
a distinction between those two things.
And I think that's really important, isn't it? It's really important to validate people's experiences, people's sensations, people's experience of pain, people's migraines, whatever it is. It's really important to acknowledge, like, yeah, this is really difficult. Nobody would choose. I sometimes use the metaphor, the analogy. Have you seen is it Disney or Pixar, one of the two, the program Soul, where there's
Yeah.
like little bubbles, souls up there, and they're waiting for a body. And I've sometimes used that idea, like if we have us as a person, like me as my personhood, and the things I enjoy doing, the things I find funny, like we can identify there's a me part of that, right? There's an I. And if I were to walk into, I don't know, a huge like stage costume warehouse and I were able to pick my own body, would I pick a body who persistently experiences pain? Would I pick a body who persistently has chronic sickness or nausea or migraines? Would I pick a body whose body dislocates or is severely unwell for whatever reason? Would I pick a body that was going to get cancer when it was 10 years old? Like, we wouldn't pick those bodies, right? You'd go down the other aisle and you'd pick a different costume to climb into. We have to validate your body is experiencing what your body is experiencing. And in so many ways, that says nothing about you. It doesn't change your sense of humor. It doesn't change what you stand for in the world. It doesn't change your morals. It doesn't change how you want to treat people. And to a degree, it does, right? Because when your body is so unwell for whatever reason, it changes how you are able to engage in the world. And I think that's a lot of the grief and loss and sadness that people then experience. But absolutely, to clarify the question you just asked there, Rich, there is definitely, there is something happening with your body. What I don't want to do within a psychological capacity is then add a whole list of diagnoses to why you feel the way you feel. I personally haven't experienced that to be helpful, and I don't find my clients find it particularly helpful. If they want to use that language, it's fine. If they say I'm anxious, it's not okay. Let's go with the language you're bringing. And I'm not going to label you as an anxious person. Like, I'm not going to diagnose you with something because you're struggling to be in the body that you're in.
Okay, thank you.
So one of the things you've told us, Dawn, is that although you have been experiencing a range of things that turn out to have been linked to this diagnosis, although you didn't know about it at the time, your interest in this psychological approach, this ACT, sort of predates you knowing about this diagnosis.
Yeah.
So that kind of was some knowledge that was already there as you were walking into this new diagnosis with all the pressures that brought, that you've already talked to us about. So what helped you? I mean, what helped you from that stuff you already knew to make sense of and make choices about how you respond to this new situation you found yourself in?
It's a hard question to answer because it's so varied, right? And I suppose from an acceptance and commitment therapy perspective, we would be looking at a broad range of skills that we're trying to develop. And I felt like I had developed those in some areas of my life and then got this diagnosis. It didn't feel particularly kind or helpful when it landed. It felt like a huge shock. And I felt like an absolute novice using my ACT skills here all over again because it was such a different topic of life to apply these skills to. If we think about the title, acceptance, it's the first word. it's the hardest thing to do, to then kind of take on board, I have this diagnosis, this has been me for my entire life to date and will be me until my life ends. That's a really hard thing to take on board. So whether your diagnosis is cancer or a chronic health condition from here on in, or whether, like me, you've had it for all of your life anyway, I think it's a really hard thing to try and get your head around, that life is going to feel like this now in lots of ways. And so there is some level of, am I willing to meet my body where it's at? And that's probably one of the hardest things to get my head around. And I still really struggle with that quite a lot of the time because I don't want to accept it, right? Who would want to? So I notice physical pain and think, well, I'll just move through it then. I notice fatigue and I think, well, I'll do it tired then, because I really want to push forward with my other values, So my commitment to doing things and what I'm then able to do whilst feeling incredibly fatigued is sometimes very, very little. So I do have to at points just say, I can't do a particular task or a particular commitment. And even things like then making a meal. It's like, okay, I'll make a meal whilst I'm tired. People will tolerate being incredibly poorly from chemo and radiotherapy because they're holding on to the outcome being very, very different. And I suppose with my condition and lots of other chronic health conditions, that isn't the case.
Mm.
So there isn't take this pill or do this thing or do these exercises, or if you were just stronger. Like, it doesn't matter what that strategy is. There isn't a guarantee or a kind of clear outcome anyway. So it's a constant state of having to track where you're at in any given moment, and literally moment to moment, and then having to make another decision. And I remember when my mum was poorly many years ago now, and I said to her, if you've got two choices, pick the kind one, Mum.
Mm.
And I try to remember that, right? Like if I am struggling and I'm really struggling, I have to pick the kind choice because it's the only thing in that moment that I could do that then feels helpful, because pushing through makes things worse, right?
It strikes me here so we're just in skill number one here of like acceptance, but you've sort of outlined two different strands of acceptance. If I've heard you correctly, like one is I want to do this thing that I care about. So there's this particular value driven behavior that's important to me. And acceptance is taking my fatigue along with me or my pain along with me as I do this value driven thing, and recognizing that it's perhaps not going to be as shiny as I wanted it to be, and it's what I've got. And so there's that type of acceptance. But then there's also another type of acceptance, which is I can't do the thing that I want to do today because my pain or fatigue is just too great. And so there's this sort of acceptance of having to, I guess, just suck it up, right? Sometimes that as much as I want to do X, I can't. And there's no amount of me wanting to do it is the thing that's going to make it happen. And so I'm just going to have to not do that thing and accept that this is my life today. Am I on the right lines there in terms of these two different things?
Yeah, spot on. Yeah, I think that's really important to notice, and it's always an active choice, right? So deciding is a really complex equation. That's often the phrase I use with my clients. It's a very complex equation. It isn't just I'm in pain today, because I'm in pain most days. So something that potentially other people would find, I've hurt my back, therefore I can't drive to work today. I drove to work for 6 months with a prolapsed disc, which was incredibly painful, and I couldn't stand up, I couldn't sit down when I got to work, and I would continue to go to work because the alternative being do what? So there are times where I will tolerate what I now know to be an unusual amount of pain for most other people. And that's been quite a normal amount of pain for me. So we have, like, I say we, it's like me and people with chronic health conditions, we have to track. We have to know what's going on. And then there's a very active decision. Yes, I can do that today with the acceptance that my pain, my fatigue, my whatever is coming with me. Or actually, no, I can't. And today is one of the days where I have to back out of what I've agreed to do or committed to do.
The eagle-eyed, no, that's not right, eagle-eared listeners will also notice, those that are familiar with ACT will also notice that you're folding in a lot of present moment awareness there, that these are flexible decisions that are taken moment to moment. In order to do that, you've got to be turning up in the moment, right? To know what's going on outside of me, what's going on inside of me, and what's the functional decision for me to make in this moment.
Absolutely. I think, again, this is why ACT feels such a helpful model, because it brings all of these different skills together. And that's why when Ray first asked me the question, it was like, oh, where do you start? You could start anywhere. You could start anywhere with any skill. And had I picked up values or self as context as a place to start, we would have been talking about acceptance, present moment, ways that I diffuse from my thinking, how I get hooked by things, how that's unhelpful to me. We would have talked about all of those things anyway. I think that's why I find ACT a very helpful model to use with myself, but also with clients, because it gives us all of these different things together. And that's where we have to get to, isn't it? It's not a case of learning an exercise or doing, having a tool in your toolkit and just using one tool all the time. It's the kind of finesse of ACT, whether you're trying to do that professionally or personally. The finesse of that is knowing, which tool do I need? How do I use it in this moment? Even a hammer, for example, you can hit something with a hammer and it's effective, right? You can also get nails out of the floor with a hammer by using the claw side of it. So even the tools that we've got to know how we can use them, and how we can use them with much more precision and finesse than just hitting everything with the hammer end, right?
One question I always find interesting when we're talking about how are we applying any kind of processes to a situation is, well, what would the opposite of that look like? Because that can be quite a clarifying question. And I guess from a lot of what I've heard from you, Dawn, like the opposite that I'm sure you've come across, I've come across a lot, and I'm as prone to as anyone, is that we can get really stuck in what we might call rule-governed behavior. That, I mustn't let people down. I should always. If this happens, then I must. And rules are really useful and they're really helpful. The difficulty is, of course, when they rub up against reality, they can be the dominant factor. And so you are no less able to do the same thing than if you weren't thinking about rules. However, the sort of self-punishment and the damage to one's sense of self, if we don't even have that, I know what I'm thinking, I know what I'm doing, we can't delete those rules if we grew up with them. But just that bit of awareness of them can then allow us to say, this is happening and it sucks that this is happening.
Mm.
This is probably the least worst way of handling the fact that this is happening, rather than just being stuck into it should be other than this.
Absolutely. One of the things I wrote about in the book chapter that I've drafted, so it may change before it ever gets published, I don't know. And so far it's drafted and with the publishers. So was exactly that. Basically I structured the latter part of my chapter using the ACT matrix, and did a pre-diagnosis ACT matrix and a post-diagnosis ACT matrix once I'd then applied some ACT skills to myself. And the thing that I noticed in my pre-diagnosis, pre-applying ACT to myself in a kind, compassionate way in terms of physical health was that my mind would generate all of those things you just said. You know, I should be reliable, I should go to work, I shouldn't be in pain. Okay. If only. There were loads and loads and loads of thoughts and sensations that would come up that were very judgmental. And my box 3 strategy, which is logical, like I don't want to let people down, I don't want to kind of offend people, I don't want to be seen as unreliable, I want a promotion at work, I want to, all of those things in box 2. And my box 3 strategy was ignore and push down. I push through symptoms, don't highlight them, don't acknowledge them, don't think that they're there, don't notice that they're there, and everybody else can manage this, so I should be able to manage this. So on and on and on we go. And what happened as a consequence of living like that was my world got incredibly small because I could keep up with my job at the time, and that came at a huge cost, right? And the huge cost of that was many, 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 many weekends I would get home at Friday evening and not leave the house apart from a dog walk until Monday morning. There were many weekends where I lived on my own for a while and I literally didn't speak verbally. I didn't speak to another human being from Friday night to Monday morning. So I'd say bye to my colleagues at 5:00. I'd drive home. I would survive the weekend in a way that was basically trying to recover for Monday morning. And then I would show up on Monday morning, bright and breezy, and other people would have been to gigs, been away, gone on holiday, connected with people, gone out for walks, had picnics, you name it. They were doing their lives. And I was like, yeah, I haven't been out, and I think it's those kind of things where you start to realize there's a huge cost for me, I'm not judging anybody else, but for me, there was a huge cost in not applying ACT skills because I wasn't doing the noticing, I wasn't doing the acknowledging, I wasn't doing any form of acceptance. I wasn't living by my values, I wasn't committing to any of my values. I was seeing myself as fine comparatively to other people. I was seeing myself as kind of, in inverted commas, normal, and holding myself to those standards, which was really hard, that my body just wasn't able to do that. And so in the book chapter, I then reflect on, well, what does ACT give me? It starts to give me choice. It starts to open doors to making different decisions. It starts to give me empowerment, actually, like I get to decide. Like I'm the only one that lives in this body and nobody else gets to decide how that feels. So there's something in there about how I get to choose. And again, it's still not black and white. It's still not a case of I'm in pain, so I won't, because I couldn't live my life like that. I wouldn't do anything.
You're describing a quite a classic sort of actism, I suppose, that the idea that it's very tempting when we experience uncomfortable thoughts, emotions, bodily sensations to immediately kind of press the avoid button. Like, I don't like this experience, so I want to get rid of it, because we like the sort of smaller, sooner reward over the larger, later reward. So it's like, if I just get rid of the bad feeling, then I'm better off. And that'll get you through the day. But like, if you look back on a life of days like that, that's kind of not the life you want. And I suppose where I think, this sort of classic ACT idea is that you instead of spending all of your time trying to turn down the bad stuff, could you devote some of your time to turning up the good stuff? Could you identify what it is that you care about and make some moves towards that, so that life becomes about like how do I make it bigger rather than just trying to keep it small? And like, you sort of touched on that there about keeping your life small. I'm very mindful of time and don't want to keep you all day. as much as it would be interesting to talk to you about this for a long time, I'm sure there are going to be people listening to this for whom your experience will resonate because they have some kind of physical health issue that they're struggling with. I wonder if you had like one thing that you would say, this has really helped me, that you could kind of recommend. What might it be?
My mind is cycling through all the things that feel helpful. To summarize them into one or two clear points is really hard, and I will take your challenge. I think in terms of living a life that feels more enriched and more enabling, despite symptoms, whatever those symptoms might be on any given day, I cannot stress enough the importance of growing a sense of compassion to oneself and learning, and I emphasize that because we are not taught this, but learning for yourselves how to set boundaries. So part of my mind was thinking, oh, which of the ACT skills do I pick? And do I pick values and tune into the thing that's most important to you? And yeah, absolutely. Like if you were to do some ACT work with a therapist or a workbook, or you want to pick this up, there are so many ways that ACT can be incredibly helpful. For me, it's almost like ACT becomes the foundation, and then the real intervention pieces start when we start being kinder, when we start allowing ourselves to make those choices because we've done the tuning in, because we've done the acceptance or the willingness to notice my body won't do that today. Then what? That's the most important bit. Because on those days, and I had a whole spate of them very, very, very recently. Yeah, I cry. I am sad. I am sometimes journaling and a lot of the time not able to pick up a pen to journal. So sit with my thoughts of this isn't fair. This isn't what I want. I'm desperately trying to do something else and my body just won't move today or can't move today in that way. So there's a lot, like how do we manage that? There's no strategy I've got that's going to make my body do the thing. The skill I've then learned to develop is to be kind. This is a terrible, terrible day and you feel awful, trapped in the skin that you're in. What do you want to do? How do we cope with that? And, the answer to that is different for everybody. Some people might want to watch TV. Some people might want to have some comedy in their lives. Some people might want to sit quietly doing an activity that they feel able to manage. And we can only do that when we've learned to set boundaries, right? When we've learned to say no to other people, when we've learned to say, I could do a task up to this point, and being able to communicate that very clearly with people. Those two things, I think, are basically what happen when you apply ACT well. So there's a whole foundational piece of work to do. If this is very new to you, there's loads that can really start to change how you think and feel in your own body. And the kind of pinnacle of that, I suppose, is compassion and boundary setting.
Yeah, nice. It reminds me of what you said to your mum, that idea of kindness. And if you've got a couple of options in terms of how you respond to this difficult situation, like pick the kind one. How about you, Ray? Anything that you will take away from this or think it would be useful for others to take away?
I think one of the things, it's not explicitly a single thing that Dawn has said, but it's kind of a thread through a few of the comments that you've made. It's that even in finding ways of living as well as you can under these circumstances, I think our mind sometimes tells us if I do the right things, everything's going to be fine. And the acceptance that it still sucks can live alongside, I'll do the best I can. And the best I can isn't about best for others, best in terms of what I need. And it still sucks. Those two things will walk forward hand in hand.
Yeah, and there must be something there about allowing that to be the case, right?
Yeah, and it's not that I'm doing okay once it doesn't suck anymore, because if the suck doesn't stop, then you're never doing okay.
The thing I would perhaps just urge people to think about is going back to the conversation we had about rules, I don't think there's anything intrinsically wrong with rules. I was having a conversation with a colleague today about this, actually, in relation to irritable bowel syndrome. There are some rules, aren't there, that you can follow them slavishly because they don't have much of a cost associated with them. The example we were talking about was if you have a rule that says always carry an umbrella in your car, there's no cost attached to it. If it doesn't rain, then you haven't lost anything really. But if it does rain, you've got an umbrella. And so I think some of the rules that people develop to manage a physical health problem are kind of like that, right? They're sort of just in case type rules. And I think rather than going on a search and destroy mission for rules, I think we should allow people to have rules if they work. So I think if you're doing something and it works for you, no matter what anyone else thinks, then just like do that, right? And do that behavior or follow that rule, and be mindful as well that you might be getting sucked into a bunch of rules that really are coming at quite a high cost. And so to be willing to stand back from all of your rules and assumptions about how life ought to be. Yeah, I don't know if I'm making sense. I'm gonna turn to Dawn. Does that make any sense to you?
Yeah, absolutely. Absolutely. And I think, from a psychological perspective, we're not there to fix things that aren't a problem for people. If somebody's living with a rule and it's not a problem to them, like they carry an umbrella in their car, like, okay, like if it doesn't have an impact on your life, where we would then need to pick up, like rules becoming more problematic, or I'm following the rule and, I'm hitting my head against a brick wall here. So, and perhaps that leads back into Ray's comment. People follow rules because they are desperately trying to make their chronic health symptoms go away in order that they can have a nice life. So perhaps, your 2 points overlap really nicely there, that we only want to pick up on the rules that stop people from accepting, how Ray explained that.
Okay. Well, just sort of lastly, is there any so your book chapter will be out. The book's not out yet, but we will add that to the show notes as soon as that's published, if you let us know. Anything else that somebody might have read or even written that might be useful to people who are experiencing this kind of thing? Not looking at anyone in particular. Ray?
Okay, I will confess a disclosure of interest.
Shameless self-promotion. That's what we call it.
Oh, shameless self-promotion. That's what it is. I did, on the back of exactly this kind of stuff, some of the uses for acceptance commitment therapy type of approaches to people living with a range of long-term physical conditions. I did a few years ago write a sort of self-help book called Living with the Enemy, and that is still available from all good booksellers, including ones that actually pay their taxes. So that does exist out there, and you might be in a position where you could get it on an interlibrary loan or something if the cost of the books would be the issue.
I would like to say that I highly recommend that book, and literally do recommend that book to lots of people. Not because I know you, Ray, but because this approach is incredibly helpful. I think it was a very well thought through, very well written book. And it's been very helpful to lots of people I know, including me. So thank you.
Oh, well, thank you, Dawn.
The other thing I think we should probably put something about in the show notes is the ACT matrix, because Dawn referenced that earlier, and there might be a few people out there that aren't as geeky as us that might not know what that is.
Absolutely.
Okay, so ready for your question?
Oh, yeah. As ready as ever.
Let's go and ask Ray, shall we?
Okay, so today's question comes from Aisha Shahid, who is a clinical psychologist in training at the University of Birmingham. And she wants to know, Ray, if you could, which superpower would you have and why?
God, I've thought of this before and it's gone. Perfect recall. Perfect recall. I would definitely have.
A functioning memory.
Listen, when you hit your 60s, a functioning memory counts as a superpower. I'll take that. What about you, Dawn? What would you choose?
Oh, it's really interesting. I suppose based on tonight's topic, the thing that popped into my head when Rich said the words was, I would love to know, to be able to have the power to like know how somebody else's body feels. So really simple things like when there's me and there's another person and it's, I don't know, walking the dog or making dinner or moving tables at a conference. Like, it doesn't matter what the task is. My mind takes over and I think I should do that. I'm well enough to do that, and so I should do that. And then quite often other people say, "Oh no, I'm fine." But me saying I'm fine is, well, I'm not really fine. Lots is going on, lots of sensations, pain, an injury, whatever. I'd be so curious to like be able to jump into somebody else's bodily sensations and go, "Oh gosh, yeah, you are healthy. You can walk the dog." I think that would be fascinating.
Brilliant.
Okay, so
And
that's
Rich?
kind of like teleporting into someone else's body to see how it feels.
Just temporarily. So I wouldn't
Temporarily.
stay there.
Okay, yeah, okay, could get a bit creepy, couldn't it? Yeah.
Just like let's make a decision in this moment. That's all. Not a
Right. Okay.
yeah.
So you'd
Not
use it to
outright
help
possession. No.
No.
Not at all creepy.
And Rich, what's yours?
Well, I'm not sure whether this counts as a superpower. I think it does because, like, if I could do it at will, it would be a superpower, wouldn't it? I would like the ability to time travel. I would like to be able to just go whenever I wanted. If I just sort of had a thought about, I wonder how this is going to turn out in the future, I'd like to just go and visit that. Or if I had a thought about, I wonder if that really happened in the past, I'd like to just be able to go nip back and check it out. I would promise to not to use it for like evil purposes. Like I wouldn't go and place a bet on the outcome of the 1966 World Cup final or anything. Just out of curiosity, more than anything. I would love the ability to sort of see things from all different periods of time.
Well, maybe the superpowers we choose is like a test of values of what matters to us.
Now, see, I feel like Aisha is sitting there feeling cheated. Like she's spent time to think of the question and send it in, and all you could come up with was, "I'd like my memory to work properly." I'm going to give you another go, Ray. Come on, come up with something a bit better than because that's not a superpower, is it? That's just I want I want the memory that I used to have. That's not that's not really a superpower. That
Okay, well, if it was classic superpower, I think, and it is a very cliched one, I'd go for flight. Just the ability to actually fly. Wouldn't that be amazing? You just swoop up through the trees, over the town, all of that. Yeah, I would take flight.
for the sheer enjoyment of it, or for sort
Yeah.
of functional, practical reasons, like
Nope,
getting places
just
really
for the fun of
quickly.
it. Just for
fun.
the fun of it. Because, I sit in my back garden and watch the birds fly overhead, and you just got to think, that looks awesome. So there's my superpower.
Okay, that's better. Yeah, well, I think we can rest easy on that. So listen, Dawn, thank you very much for joining us. It was a lovely conversation, and I really am grateful to you for being willing to talk about some of your personal story and your personal journey with this. Thank you for the time that you gave us. Really appreciate it.
Oh, thank you for having me on your podcast. Much appreciated.
Thank you so much, Dawn.
Thank you.
And we'll be back in another month's time with another guest. So thank you very much for listening and take care.
Bye.
Bye.